Many people wonder, how do I know if I'm not cut out for the nursing profession? And that's a really tough question to answer because in nursing, there's so many different areas that you can work in. And if you don't like some of the things I'm about to mention, you could probably still find an area of nursing that you would like. Also, one thing I would like to point out is that there are a lot of great nurses out there who have struggled with one or two of these things, but they are able to overcome them, and now they work in the profession and they love it. However, if we're talking about that traditional bedside nursing role, I'd say you may want to pick something different if you don't like majority of these things. So one thing is that you are easily grossed out by body fluids. As a nurse, you're going to see a whole variety of body fluids, from poop, pee, blood, sputum, vomit, and so forth. You may even see some that you didn't even really know existed in the human body. And the thing is, not only are you going to visually have to see them, but you're going to have to touch them. You're going to have to clean them up, you're going to have to collect them to send off to a lab, and you're even going to have to smell them. So this is just all part of the job, especially for a bedside nurse. Next is that you don't really have a strong desire to serve or care for others. And nursing is all about helping others and serving them at their weakest. You will be helping patients to the restroom, bathing them, changing their beds, administering medications, explaining things to them, dealing with family members, and so forth. And then another thing is that you really find yourself not having a lot of sympathy or empathy for people. So as a nurse, you're going to be having patients who receive horrible news. They're going to get these horrible diagnoses, which could either mean that they are going to be disabled for the rest of their life, need around-the-clock care, and they're not going to be able to work, which will financially devastate them. Or they get a terminal diagnosis, which means that they will be dying soon. So this can be very, very hard for your patient. In addition, family members will be losing loved ones, and you have to also help them navigate through that. Therefore, as a nurse, you've got to show that you care. Next is that you don't have an interest in the human body, medicines, or disease processes. And the thing is that as a nurse, you will be studying a lot about the anatomy of the human body, how medications work, how these diseases affect the body, and so forth. And you'll need to know this information not only to pass nursing school and graduate, but in order to be a good nurse so you can provide safe and effective care for your patients. Another thing is that your ideal job doesn't include a fast-paced environment, physical work, or multitasking. So some jobs out there, they just really require you to use your brain, while other jobs require you to use your body physically. Now, in my opinion, nursing really forces you to use both, because as a nurse, you will be bending, lifting, and moving patients, but you will also have to think critically and know a lot about medications, diseases, procedures, all while juggling several tasks at once. And then lastly, you find that you're a lone ranger who hates working with others or participating in teamwork. Now, as a nurse, you'll be constantly collaborating with physicians, respiratory therapists, nurse practitioners, speech therapists, occupational therapists, social workers, nursing assistants, and so forth. You'll constantly be calling them, asking them for help, or helping them. And really, it takes a village to heal people. So nursing is really all about teamwork and working with others. So just to recap, you can still become a nurse if you dislike a few of these things that I have mentioned. For example, let's say that the body fluid thing is something you really dislike. Well, over time, you will become desensitized to them. You will be able to tolerate seeing them, collecting them, or even smelling them. And the great thing about nursing is that not every area of nursing is going to expose you to body fluids. You will find some parts of nursing that you very rarely see them. However, as I went through this list, if you found yourself going, yes, that's me, yes, that's me, well, you may want to consider doing something else. But if you still want to be part of the healthcare field, there are great positions out there that will fit what you like. So don't give up on going in the healthcare field just because you find that this isn't for you. And then plus, there may be some other areas of nursing that may fit you. So don't give up on the nursing profession either.